Good afternoon, I am Michaela Miller with the Tuesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. And now for the news. It is day 39 of the national lockdown and the current number of confirmed COVID-19 cases nationally stands at 700,220 with 2,746 recoveries and 138 deaths. The Western Cape has 3,451 confirmed cases of COVID-19, 894 recoveries and 64 deaths. The Western Cape's Agricultural MEC has met with key stakeholders in Witzenberg to present a cabinet-approved integrated COVID-19 response plan for the region. The Witzenberg municipality had 125 cases of COVID-19 on Saturday evening. The plan was in response to the rapid increase in the number of positive cases in the area and followed consultation with various provincial departments. Mayor said the plan addressed the current health, law enforcement and workplace challenges in the area and required everyone to work towards curbing the further spread of the virus. His department, in partnership with Agri Western Cape and AFASA, had distributed 35,198 masks to agri workers. Western Cape grant beneficiary received duplicate payments on Monday following system glitches at South African Social Security Agency paying points. In Durban, hundreds of pensioners returned home empty-handed following a shortage of funds and payment glitches at several pay points. The technical error resulted in thousands of elderly and disabled people across the country standing in queues for hours as they waited to collect their money. SASSA Western Cape spokesperson Shivani Wahab said they would try to recover funds from clients where payments reversals were not possible and that beneficiaries who had withdrawn the extra payment would not be paid next month. Nurses at clinic in Mfuleni have downed tools after one of their colleagues tested positive for COVID-19, while EMS paramedics working in Khayelitsha are also on strike over the lack of personnel protective equipment. We spoke to the General Secretary of South African Municipal Workers Union, Kuna Ramotlau, about these issues.
Good afternoon, TV. I'm joined this afternoon by the General Secretary of SAMU, the South African Municipal Workers Union, Mr. Ramotlau. Thank you so much for joining us. You're coming to us all the way from your head office in Johannesburg. We want to talk about the lack of personal protective equipment for not only municipal workers but essential workers. In Cape Town, we've been told that there was a nurse at a clinic in Mfuleni who also positive for COVID-19. Also that emergency medical services, paramedics are also working in Khayelitsha, have also gone on strike over a lack of PPEs, as they are called. What is the position of some in regard to PPPs and the state making sure that workers, essential work, are protected?
Thank you very much, and thank you for the opportunity. And good afternoon or good day to your viewership and listeners. Firstly, want to indicate that we want to say to those who have been working during these difficult times, we want to salute them on the work that they've been doing under serious conditions of insufficient PPEs provided by municipalities across the country and even in the city of Cape Town. And we want to call upon all municipalities, including the city of Cape Town, for them to ensure that they're able to can provide workers with necessary personal protective equipment. And we're doing that in the context of understanding that there is a relaxation of the levels. We're now at level 4 in terms of the COVID-19. And our approach is the following, is that we are in a process as an organization, firstly, to collate information from all provinces, including all municipalities, where we want to be sure that there is compliance, because it means certain number of employees will be required to go back to work. We would want some level of compliance from municipalities to confirm that those who are coming back to work and as critical employees to assist us to flatten the curve should be able to be protected so that the curve cannot go any higher. The curve of the pandemic must be flattened. It must not grow any further. We're at a point where we're aware that there is an issue that was raised by the city of Cape Town wanting to take some regional office to court for issuing a statement about compliance to the Occupational Health and Safety Act. And we want to say it categorically now that as somewhere at a national level, that matter is not a matter for the region, not for the province. We will take it ourselves as a national office and fight the city for being unable to understand that we are told by scientists and advisors and professors that the pandemic spread much faster and we need to communicate much quicker to ensure that people are safe. Therefore, if they want to take us to court, let them come through. We're waiting for them. We're not going to stop in protecting our local leadership, our provincial leadership. We'll do so, but we're not going to be intimidated by any municipality in the country for us to be able to do what is necessary to prevent this spread of the pandemic.
GSR, let me ask you, you're talking about compliance at the municipal level. Just explain to our viewers, you say that municipalities must keep the health and safety of essential and critical workers at the forefront. What does it really mean compliance?
The compliance we're referring to don't arise out of SAMU's pronouncement. They arise out of the government pronouncement, which speaks to, firstly, if workers are to go back to work, you need to ensure that the workplace has been cleaned, has been sanitized, vehicles of municipalities have been sanitized, and there is enough protection of masks and gloves for those who must do different types of work. There must be a social distancing in between employees where they are working if they are in big numbers. And there should be also an indication to say, do you want workers to come and work for the full day, or do you want them to come and work for particular hours? Because if you are to go into different departments or different buildings of municipalities, or where the municipalities are renting offices, is that they might be using a centralized aircon system. Therefore, it means what they're breathing through themselves through when the aircon is on, it has a potential to go to the other offices. Therefore, those are the elements that we're saying needs to be put in place to cover the area of compliance, not limited to those ones, but those are examples that we're providing at this point. But we'll be able to can pronounce in full what is our proposal. Was with the meeting that needs to happen tomorrow, which must probably give us more clarity and ground information from structures from provinces, so that when we pronounce out of having concrete, substantive information coming from our structures on the ground.
Yes, one of my last questions I want to ask you now is that there cannot be, I'd like to get you, municipalities cannot be citing a lack of funds to adhere to compliance when government has made available 20 billion rand for local government. What is your view on that?
If you might have monitored our communication previously, what we have done was that we communicated to say the 20 billion that's supposed to come to municipalities, it needs to be protected from the daylight pickpocketers who look at that money for their pockets, said we're watching them, that money must go where it's supposed to go to protect workers who are doing the work that is supposed to save the country.
Police have arrested several protesters in Muizenberg who attended a protest asking for the government to allow people back into the ocean. The call to action made waves on social media this week, urging beachgoers to head to their local beaches for nationwide peaceful protests. While the person who originally posted the call to action remains unknown, the post quickly went viral on Facebook, Twitter and WhatsApp. The hashtag Back into the Water campaigners believe ocean sports strengthen the immune system in the fight against the coronavirus. Now it's time for an ad break. We'll be back shortly.
We encouraged our members.
Welcome back. You're still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. With many schools and higher education facilities moving to online learning systems to ensure all learners and students are receiving education, we spoke to Crystal House CEO Adrian Marais to find out what they are struggling with and how online learning serves their children.
Good day and welcome to the Our City COVID-19 show. Today I'm joined by Adrian Marais, who is the CEO of Crystal House, and we will be talking about their online learning system and how they are helping families in the time of need. Welcome, Adrian, thank you for joining us.
Thank you very much.
As we start off this conversation, can you tell us a bit more about your online system, how it works, and how you guys go about catering to the needs of children online?
Yes, and in many ways we try and look at the silver lining of COVID to think of it more as an accelerator than a disruptor of the way that it used to be. So our strategy for this year was really to get far better with online learning, blended learning, flipped classrooms, etc. And now we've been absolutely thrown into the deep end. So we're building the bridge as we go. And have done really, really well. So within 48 hours of knowing that we're going to close down, we were very privileged to be able to issue all our high school children with a very modest little tablet and quickly upskill everybody on Zoom. And there we had online learning going. So our junior school, they don't have electronic equipment, but we issued them with workbooks and et cetera, that they took home. Their parents worked with them, little WhatsApp bites. It's amazing what electronic media can do. Most of the schools I know use WhatsApp extensively, and we've blended WhatsApp's combination by Zoom. Data, look, if I can just quickly on the side say the biggest digital divide. There's such a stark light on the digital divide. Without data, you cannot do your work. So we've been very, very smart in trying to buy cheap bundles. Then our teachers give tons of information on Zoom, the whole class dialing in, the whole class, like 40 people at a time would dial in. They would go out, do work on their own, receive through emails and WhatsApp pods in terms of support, then back to a normal classroom. So we took our regular classroom timetable and wrote it out in our high school like that.
When it comes to those kids that are not able to access facilities like your libraries since lockdown, how do you guys go about ensuring that all kids across the spectrum are having a equal learning experience, specifically those who are unable to get to facilities as well as if they don't have money for data?
Yeah, so that is, of course, the national problem, and our children are no different. 100% of our children don't have access to libraries, etc., at the moment because it's closed, and 100% of our children really, really struggle financially. Crystal House, we survive on funds that we raise to provide schooling for every single one of our children who survive on less than 1,500 rand per month. So no starter. What we did do is we went on a massive fundraising campaign to try and raise money and to shift our budget away from things that we now won't spend, to provide every single student with minimum amount of data that we then, through these little pods and dialing in and dialing out, work with.
What are some of the difficulties that you guys have faced since the start of online learning?
Sure. Well, the one is just technology as it is. You know, even with all the data in the world, to get every tablet to work. Remember, we were planning a protocol to close down a week before the close down. And then on Sunday, when President Ramaphosa said we're closing down, within 48 hours we were closed. So some of the tablets weren't properly set up. Then the kids phone through, then they can't dial in. Then we've got our IT guys trying to sort out a password. So the idea that 50 or 60 people can dial in really, really works if you practice it a bit. So connectivity, getting people to know how things work, timetables to work, etc. Those things were very difficult. And then typically, which is really difficult with data, the data provider's faulty that way is often when you turn a tablet on, all the updates run, eat all your data and you're out of data again. So there was a massive learning curve for us in that respect.
Yeah. Now that the Department of Education has announced that there will be a possibility that schools will be reopening and in a phased-in approach, what are some of the concerns that you have regarding kids coming back to school and in terms of COVID in a whole?
Yes, so of course we're extremely concerned. The one thing I can say categorically is our children at Crystal House South Africa, they're not going to be back at school on Monday or Tuesday or Wednesday. It's not a workable solution. Nobody agrees with that, and there's no way that that's going to happen. It certainly won't happen in our school. So when we closed down, we had a people-first approach. We said curriculum is important, learning is important, progression is important. There will be national guidelines on that, but people first, safety first. So that was important. As we planned to lock down, we started building a protocol to unlock down. So we've spent the last number of days building protocols on how to bring people back safely, how to bring them in a phased approach, who stays home, who comes to school, who gets on the bus, what does the mask look like, where do we measure temperature, where do you scrub your hands when you arrive, every single aspect. We've got a protocol on how to go to the toilet for the teachers as well as for the staff. How do you open the doors? How do you close the doors? So we're very, very concerned and very, very clear about the importance to put safety first.
How will schools reopening now affect your online learning system?
Yeah, it will definitely continue for two reasons. We're going to be with a COVID narrative for the balance of the year. There's no way about that. Then going forward in 2021, when we all play catch up and reconciliation and reintegration, we're going to sit with COVID as well. So very, very early on, when we were planning a protocol to close down, we were clear that online learning is here to stay.
Last question before we end off our discussion. Let's talk about your Give and Gain initiative and how you guys plan to assist, families that are destitute. And are you guys planning on continuing the assistance even post-lockdown?
The answer is yes and yes.
In terms of people getting involved and donating and giving to the school, where can they reach you and how can they get involved with your Give and Gain initiative?
Yeah, so they can reach anything through our website, of course, which is www.sa.crystalhouse.org, sa.crystalhouse.org, where you can pick that up. You can just Google us, or you can contact any one of us. My number is 082 774 3237. If you connect with me, I will connect you with everybody.
Thank you so much, Adri, for joining us, and thank you for the viewers of Cape Town TV for tuning in. You can get involved with Crystal House in terms of donating and seeing how you can help alleviate the pressure on some of the families. Thank you, Adri, for joining us, and have a very good day further.
Sports, Arts and Culture Minister Natim Tetwa held a media briefing on Monday to give an update on the COVID-19 relief fund for the sector. Tetwa recently announced a 150 million rand fund and said the department had received 5,000 applications from the arts and culture sector and 300 from the sports. Let's take a look at some highlights from that briefing.
From the side of arts and culture, we do not have the kind of federations which we have at sport and so on, but we do have organizations, national organizations, like CIFSA, like SAMIC, like SACHIVE, and so on. So those organizations, SASFED in the film industry, IBFC, also in the film industry, we are going to be having a conversation with them. So we'll be convening a meeting with them with an aim of getting them on board to help us to reach out to the artists. Because in the final analysis, we're not going to be happy as government that money has not been spent when we know there's an outcry out there, when we know there's desperation out there. The following mitigation measures for alert level 4, according to subsector, are necessary to prevent the spread of COVID-19. Subsector, performing arts institutions or playhouses that have relevant infrastructure or facilities used for the creation and production of local content. The mitigating measures there, these facilities can produce content for streaming and live streaming without audiences. Monologues, minimal cast and technical support are required. Production must take place in compliance with Regulation 28, subsection 2 of the regulations, which requires that a compliance official to ensure that safety controls are strictly adhered to be designated. 2, all directions in respect of health protocols and exposure to persons to COVID-19 must be adhered to as per Regulation 16, subsection 6. 2, film and television production using local cast, living legends, and crew. This will include jobs throughout the value chain of production, post-production, such as technical crew of sound engineers, special effects, and animators. The mitigating, all directions in respect of health protocols and exposure of persons to COVID-19 must be adhered to as per Regulation 16. The following additional requirements will apply to content production. 1, visibility of protocol information, information regarding the risk of spreading COVID-19 and what behavior is expected from everyone on set must be made to be visible in common areas and must be copied to all personnel of the company. 2, preparing the workplace. The following are guidelines to prepare the workplace and a daily routine to be established thereafter. 1, sanitizing of the environment needs to occur before shoot commences, during each shoot day and after rep each day. There must be dedicated cleaning staff to sanitize and clean bathroom spaces on a regular rotation throughout the day. A daily register of all persons granted access to the set with details of their daily temperatures must be compiled. Getting to work, transport. Where possible, all crew and cast must use their own transport. For those without their own, Transport must be provided by the production in terms of the guidelines issued by the Department of Transport. Any transport arranged by the production management must be provided with a driver, and all occupants in the vehicle must wear face masks. The catering on set, catered meals and craft must be packed in boxes per person with sealed cutlery. Alternatively, the crew and cast must be allowed to bring their own meals. There must be no shared craft and catering areas. Crew and cast must be supplied with their own water bottles. Cast and crew on set and shooting floor, as provided for in Regulation 23, subsection 1b, cast and crew as workers must be allowed. The number of cast and crew must be kept at a maximum of not more than 50 people on set, inclusive of cast members. The curfew time of between 8 p.m. and 5 a.m. must be adhered to. To start with the adjudication process under sport, this panel was the first to be appointed on the 9th of April and the first to begin the adjudication process. That day, the 9th of April, was also a deadline for proposals for service provider applications on the proposals for live streaming. A total aggregate of 473 applications were received from 25 sporting federations.
Now we will move on to the opening remarks at the daily press briefing on coronavirus COVID-19, which was held on Monday.
Good morning, good afternoon, and good evening. 10 days ago, I joined President Emmanuel Macron, President Ursula von der Leyen, and Melinda Gates to launch the SET Accelerator to support the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics against COVID-19. Today, leaders from 40 countries all over the world came together to support the SET Accelerator through the COVID-19 Global Response International Pledging event hosted by the European Commission. During today's event, some 7.4 billion euros was pledged for research and development for vaccines, diagnostics, and therapeutics. This was a powerful and inspiring demonstration of global solidarity. Today, countries came together not only to pledge their financial support, but to also pledge their commitment to ensuring all people can access life-saving tools for COVID-19. Accelerating development of the products, but at the same time, access to all. Recent advances in science are enabling the world to move at incredible speed to develop these tools. But the true measure of success will not only be how fast we can develop safe and effective tools, it will be how equally we can distribute them. None of us can accept a world in which some people are protected while others are not. Everybody should be protected. None of us are safe until all of us are safe. The potential for continued waves of infection of COVID-19 across the globe demands that every single person on the planet be protected from this disease. Several countries are now starting to ease so-called lockdown and stay-at-home orders. But our common commitment to basic measures such as cleaning hands and physical distancing cannot be relaxed. Nor can the commitment to the tools that are the foundation of the response to find, isolate, test, and care for every case and trace every contact, and to ensure health systems have the capacity they need to provide safe and effective care for all. But just as the number of new cases and deaths is declining in some countries, it's mounting in others. That's why today's pledging event is so important. This virus will be with us for a long time, and we must come together to develop and share the tools to defeat it. But of course, today's event only covers one part of the response for research and development in vaccines, diagnostics, and therapeutics. In the weeks and months ahead, we will need much more to meet the demand for personal protective equipment, medical oxygen, and other essential supplies. Later this week, WHO will launch its updated strategic preparedness and response plan, which will provide an update of the resources WHO needs to support the international response and international and national action plans to the end of 2020. WHO is grateful to the many countries and donors who supported the first strategic and response preparedness and response plan. And we are also grateful to the more than 300,000 individuals, corporations, and foundations who have contributed to the Solidarity Response Fund, which has generated more than $210 million in just 6 weeks. As my friend Boris Johnson said during today's pledging event, we're in this together, and together we will prevail. We will prevail through national unity and global solidarity. The antidotes to this virus are national unity and global solidarity. The antidote to this virus is the human spirit. Thank you.
We are taking a short break. When we come back, Octavian Globe will update us on the latest social media.
Welcome back. Before the ad break, we had Michaela Miller with the latest news. There are simple things you can do to keep yourself, your colleagues, and your family members protected from COVID-19. Watch the short animation and learn how to prevent COVID-19 in your workplace or while teleworking.
Preventing COVID-19 in your workplace or while teleworking. There are several things you can do to protect yourself and others from COVID-19 in your workplace, whether you are at your work site or teleworking at home. Follow distancing measures issued for your location and stay informed through information from trusted sources, such as WHO and your local health authority. Stay at home and avoid direct contact with anyone if you feel unwell or even have a mild cough. This will help protect your colleagues at work and your family members at home. If you are feeling well and need to go to work, you can reduce your risk of catching the virus by avoiding crowded public transport. If possible, go by bike or walk. Otherwise, if possible, discuss with your supervisor if you can work from home. At work or at home, if you can, use the stairs instead of elevators. Avoid using your hands to touch common objects like elevator buttons, door handles, or staircase railings. If you work in an office, create distance-based meetings either through video conferencing or by maintaining at least 1 meter space between people in the same room. If you work in contact with the public, stay at least 1 meter away from others as much as you can. After commuting to and from work and throughout the day, clean your hands frequently and thoroughly. Avoid touching your eyes, mouth, and nose. Ventilate your workplace regularly, keeping the windows open if possible. Make sure tables, door handles, and other frequently touched surfaces are disinfected regularly. Avoid crowded places and unnecessary public activities. Find no-contact ways to greet your colleagues and express affection to your friends and family. While maintaining physical distance, stay social. Contact your family and colleagues regularly to check how they are coping. Remember to seek ways to stay active and positive. Stay healthy, and let's all prevent the spread of COVID-19.
And now for social media. Share your thoughts with us. We're on Facebook, we are Our City CT, and on Twitter at Our City CT. This is a time we need to come together as a nation. This is the popular hashtag on Twitter today. Hashtag ENCA must fall. The independent news channel is under fire after 2 of its morning hosts questioned the decision to continue the cigarette ban and whether COGTA Minister Dlamini Zuma had undermined President Ramaphosa. After the ad break, we'll be crossing over to Michaela Miller, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavian Glover looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via our email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Michaela Miller and Octavian Glover, goodbye.